So I will continue my previous lecture. So this is how the post-hepatic jaundice will be happen. Okay, and now I'm talk about the post-hepatic. This is also a cause of post-hepatic jaundice. Then there is a primary sclerosing cholangitis, mean what there is an inflammation of bile duct, and then there is scar formation. So hepatocyte unable to drain the bile into the bile caniculi. Now I talk about what's the key history point in which you will take in the patient with jaundice. So these are the key history point. Like if some patient in patient you are suspecting jaundice, so you will find in a symptoms there is a itching sensation, then there is abdominal pain. If then there is abdominal pain, might be possible there is a gallstone. We also call stone in gallbladder. And if there is a weight loss, so weight loss, chronic weight loss more than 2 to 3 months, suggestive of chronic liver disease. And if there is a dark urine and pale stool, if there is a dark urine and pale stool, they suggest of what? Obstructive jaundice. So weight loss suggestive of chronic liver disease. If some patient complaining of fever, jaundice and right hypochondriac pain, that also known as charcot-triad, they are suggestive of what? Cholangitis. The symptoms you will found, if because symptom will give you a clue about to go into reach your diagnosis. So if any patient give you a symptoms or give you a history about any of this feature, so in your mind might be possible in different diagnosis like chronic liver disease or cholecystitis or cholangitis. So taking history is very important in patient with jaundice. Also, if drug history and other history in patient with jaundice. If some patient you might be suspected of jaundice, so you can ask that if any in the past exposure to IV drug abuser or blood transfusion, because they lead toward hepatitis A and hepatitis C virus, and also hepatitis B and C virus, because A and E mostly due to food contact and B and C mostly due to blood transfusion. So they will give a clue about hepatitis B and C virus. Then you ask about the traveler history, then you are, because in traveler history they eat something and then they cause viral hepatitis, because viral hepatitis is very common in Pakistan. So diabetes history you also take, because diabetes also somehow can destroy the liver. Also autoimmune disease history, because sometimes autoimmune destruction of bile duct or hepatitis can be happen. And then you ask about the inflammatory bowel disease or family history of liver disease. This is very important, because if someone have family history of liver disease, so might be possible in the future generation family member, like if father is hepatitis, already have hepatitis, so in the children maybe that will be cause hepatitis. Okay, so this is a thing, family history is very important. Now I will talk about what are some clinical features which patient give you a clinical sign. Like patient with jaundice will give you a sign of abdominal pain, might be in the right hypochondriac region, in the epigastric region. Then there is a yellowish color of skin and eye, and then there is a nausea and vomiting and swollen abdomen and itchy skin due to accumulation of bile salt. Then there is a weight loss. Why weight loss? Because patient is unable to eat food or take food properly. And then there is a, if you examine the patient, then there is a, this is a right hypochondriac region. This is a right hypochondriac. If you palpate a right hypochondriac region, patient might be develop pain. So in right hypochondriac region, if patient develop pain, feel pain, so that can be due to the hepatitis or pathology in the liver. Then now I will talk about the some examination point or some test, some sign in which you will confirm your diagnosis. If some patient, so in some patient, if give you a you are suspecting some acute cholecystitis, so this is a sign you will do in the patient with acute cholecystitis. Okay, in my next video I will talk about this test in detail.